Did you know that prenatal stress and birth trauma are amongst the top reasons that babies struggle in their first few years of life? From colic to constipation, sleep struggles, torticollis, plagiocephaly, tummy aches, leading into their older years of sensory struggles, ADHD, and anxiety. The list seems never ending. What we are seeing today in offices all over the country is that the paperwork always has one common denominator. Moms will say that they were so stressed out during their pregnancy, or they had such a traumatic birth that they remember the doctor having to pull so hard to get the baby out. Other things that we've heard are, I lost a loved one while pregnancy, or this is our rainbow baby after numerous miscarriages. The theme is that there's stress, and a whole heck of a lot more stress. And so how can we help to ease this stress for both expecting moms and their babies? Obviously, we can't control what happens in life, but what we can help is the nervous system to be able to work through and process this trauma easier so that both mom and baby will be more adaptable and resilient to all that life brings, hoping to possibly avoid some of the common symptoms and struggles that we mentioned earlier that we see with babies after birth. If you're an expecting mom or you want kids in the future, keep watching this video as we're going to talk about how you can start influencing your child's nervous system even before they're born. This video is for you moms or expecting parents, for that matter, that are planning to have babies within the future, or families who want more babies, and anyone that's really curious about how to have the best pregnancy and help them learn more about the development of their baby's nervous system. We're going to be diving deeper into the health of mom's nervous system during pregnancy and how it can influence baby's nervous system development within utero. You're going to learn how the vagus nerve influences your baby's growth, why it matters for long-term health, and how you can support optimal development during pregnancy and beyond. At Haven Family Chiropractic, we specialize in cases that involve birth trauma. Sweet babies come in who struggle with colic and eczema and sleep challenges, and we also have toddlers and elementary age kids who suffered from these challenges as babies and then have grown into diagnoses like sensory processing disorder or ADHD or OCD or oppositional defiance disorder and even autism. As we mentioned earlier, in most of these cases, mom had mentioned fertility struggles, a stressful pregnancy, or a traumatic birth. These three things are very likely, especially with how medicalized our country has become with prenatal care. Let's look at some stats to paint the full picture. So, America spends close to $100 billion on birth per year, and 1 in 3 American women have a C-section, which, the WHO recommends 10 to 15% at most, and are deemed true medical emergencies. 70 to 75% of American women receive an epidural, and 31% of women are induced. 1 out of 7 American women experience postpartum mood and anxiety disorder. And in the fertility market in 2022, there was 7.9 billion. And then it's projected in 2028 to be a 16.8 billion industry. 65% of women are on hormonal birth control. I'm so grateful for emergency medicine here in the US. We are number 1 in the world for emergency care. But unfortunately, for maternal and infant outcomes, we rank dead last. Again, not everything is in our control, but as a whole, something isn't quite right. Medical intervention is definitely needed in true emergency circumstances, but not everyone should turn out to be an emergency pregnancy and birth. For low-risk pregnancies, too much interference is happening, leading to the cascade of events that we call the perfect storm, which are all of those common symptoms and diagnoses that we are seeing time and time again within our office. So how can we best prepare our mind and our body for pregnancy and birth so that way we can have the best outcomes possible for both mom and baby? Let's go through these 4 tips. Stick around because tip number 4 is going to be the most important. So moms, tip number 1 is empowerment and knowledge. Have you ever heard the saying that birth is 80% mental and 20% physical? That 20% comes right at the end when you've completely surrendered to your body and let it do what it was meant to. When you're more educated, you know more and will do the best that you can. Tip number 2 is starting to prepare even before conception. So this is for couples who know that they want a baby within the future or ones who are going through fertility struggles. This is so much that you can do to prepare your body. We call this preconception work. It's doing all that you can do to be the healthiest version of yourself. If you attend our workshop, or we go into bigger detail on this, but at least 3 to 6 months before trying to conceive, start becoming the healthiest version of yourselves for both mom and dad. A big misconception is that prenatal life is all on mom, but that really isn't even true at all. Mom and dad play an equal role, especially in preparing for conception and the fertility phase of it all. You're creating a baby that is half of you and half of your partner. Tip number 3 is finding your inner circle. This is super important. So surrounding yourself with people who protect your vision for birth. You want friends and family and providers who are supportive of how you envision it all to go. It's okay to build boundaries around yourself during this time and say that you don't really want to hear about their birth story if it isn't going to be in a positive light. Finding providers who align with your vision and answer your questions. You should never feel belittled or irrelevant because your providers work for you. And tip number 4 is nervous system health. So finally, the most important one of them all is making sure that your nervous system is adaptable and resilient so that whatever life throws your way for you and your baby, you can process it through and not store trauma within your bodies, but instead recognize it, process it, and adapt accordingly. So let's break it down. Let's start with the most basic understanding. So our nervous system controls every cell, organ, and tissue of mom's and baby's body too. So a lot of time hormones get blamed for everything within pregnancy, from crying to mood swings to more serious topics like fertility struggles and miscarriages. Doctors love to run the chemical imbalance of hormones. As this is true, is it really the root cause? What system regulates our hormones and decides which ones are needed at specific times? The thing is that the nervous system is the one system that does. That's our root cause. When the nervous system is dysregulated, many common symptoms occur. So things like cramping during periods and increased symptoms from endometriosis and PCOS, fertility struggles, miscarriages, pregnancy pains, morning sickness, and nausea and high blood pressure and constipation. Whatever the symptoms are, we can almost always trace it back to the nervous system and its dysfunction. So how can you check if your nervous system is ready to make a baby, have a great pregnancy, and conquer birth and postpartum? The first step is to measure heart rate variability. We do this at our office, Haven Family Chiropractic, using technology that is far more advanced than the Whoop strap, your Garmin, Apple Watches, your Oura rings. We love all those things and those gadgets for daily use. But this will tell us overall how your nervous system is adapting to stress and if your body's battery is ready to take on the prenatal season. This will also tell us how baby is adapting to stress as well. As whatever mom experiences, so does baby. So we need them to be adaptable too. We also do 2 other tests or scans that will tell us even more about your nervous system. And these 2 are also fast and non-invasive. They tell us how your brain is communicating with the rest of your body, where you're storing and holding your energy, and how your nervous system is processing and dealing with the stressors like trauma and toxins. The central nervous system is the biggest reproductive organ that we have. So it controls all other organs and hormones. So we need it to be functioning at its absolute best for preconception, pregnancy, and well after birth and postpartum. If you want to see how your nervous system is functioning, DM our office and get your neurological insight scans scheduled right away. That way we can read them, look them over, check out your history, and create a customized care plan for you and your baby. We have the opportunity to impact baby's nervous system even before birth, which is wild, and I'm so stinking thankful for it all. As we said, we aren't in control of many things, but when we can control how our nervous system reacts to stress, we can have a better outcome and hopefully avoid the norm that's happening to so many of these kids today. For more information, visit the link on our bio and sign up for the upcoming To Birth and Beyond workshop. Our team cannot wait to connect with you.